Hi, this is Dr. House. I'm in my home. We're going to talk about some home care things that you can do for your infant. I'm going to tell you two things. Number one, developmentally. This is my 9-week-old Hudson. I've got my 19-month-old in the background, so if you hear some screaming, that's her. But developmentally, he can't do anything except for rolling over. So from my experience, don't sit him up. From my experience, as little as possible. Keep him flat on the floor, flat on your legs, flat in your arms or over your shoulder so you support him. Don't stand him up. The reason being, he hasn't written those computer programs yet. Computer programs, your brain does that. If you force him to write those computer programs pretty instantly, he will do it sloppy. If he takes his time, he'll do it properly. Sloppy means, end up with a flat foot. Sloppy means end up maybe with a scoliosis, with a poor posture, those kind of things. So my advice, don't put them in a position that they can't do on their own, as little as possible, okay? Number two, you can do some actual sort of manual mobilization on your infant. I think stay away from everything upper quarter, but hips, low back, things like that, you can really help a lot. Two things, I would mobilize hips, okay? Mobilize hips because they're kind of a gateway. Any tension down the legs will affect spine, spinal cord, even development, brain. So when I'm mobilizing hips for Hudson here, I'm going to take the hips and grab them really close to the joint. If they've done the testing of what's called the Barlow and Ortolani testing, which they have, you've seen the pediatrician do this, then the hips are okay. They're not vulnerable. But you want to grab the hip and just move it around. If it feels like there's a really tight spot, which Hudson doesn't have any tight spots in this direction, keep it close to the hip, put another kind of thumb over the butt, and just easy work it. Okay, if that's his restricted direction. Next up, if he has a restriction in hips backward, so his leg going backwards in a hip straight kind of position, hold him way up at the joint and then just work it. Just be light about it. Okay, I'm putting a little pressure here, just a light massage, and then I'm pushing backward. You're not going to change anything dramatic. That's what specific palpation of a professional will do. But if you will work into where he's restricted, he'll be better off for it. And huge gains in how he can move. Number two, this position here is what I call baby feet. Okay, this position here checks if there's any kind of tensions, nerve down his leg. Okay, if he's got any kind of tension when you rotate him this way and reach that foot to the sky, I would get just right behind the bones of the lower leg bone and right behind the bones of the upper leg bone, and I would softly massage. Softly massage. This is the only times when you feel like doing some work, so get him to where he loves doing this. Maybe daily, maybe take 2 minutes during the change before bed, the diaper change before bed. Those are two things you can do. Work his hips and legs. You cannot sit them up before or stand them up before they're able to do it on their own, and your child will be set up for success as much as possible. Thanks for tuning in.